What is packed cell volume or PCV? It's a fundamental concept in understanding your overall health, and it all starts with your blood. We're going to break down what PCV is, why it's important, and how it's measured. Your blood isn't just red liquid, it's a complex fluid with many components, each playing a vital role in keeping you alive and well. It's a carefully balanced mix of plasma, which is the liquid part, and various cells, with red blood cells being the most abundant. These red blood cells are the real workhorses of your circulatory system. PCV, or packed cell volume, is the percentage of your blood volume that is made up of red blood cells. Think of it as a measure of how concentrated your red blood cells are in your blood. It's a quick and informative way to see how much of your blood is actively involved in carrying oxygen throughout your body, delivering that vital energy source to all your tissues and organs. You might also hear PCV referred to as hematocrit. Don't be confused. These terms are often used interchangeably in the medical field. They both refer to the same measurement. Why does PCV matter so much? What makes it such a crucial indicator of health? Because red blood cells are responsible for the vital task of delivering oxygen to every single tissue in your body, from your brain to your toes. Without enough red blood cells, your body can't function properly. A PCV test therefore tells us if you have a sufficient number of red blood cells circulating to effectively meet your body's oxygen demands. It helps determine if your body is getting the oxygen it needs to thrive. In a lab setting, we determine PCV by separating the blood components in a specialized tube. This process results in a clear separation. Plasma, the liquid component, settles on top, while the heavier red blood cells pack down at the bottom. The PCV value is then determined by measuring the height of the red blood cell layer. This height is expressed as a percentage of the total height of the entire blood column in the tube, giving us the PCV value. Despite its simplicity, it's a powerful and informative measurement that provides valuable insights into your health. PCV is a key indicator that helps us spot potential problems, such as anemia, a condition characterized by a low red blood cell count. It can also quickly reveal signs of dehydration, where the concentration of red blood cells appears higher due to a decrease in plasma volume. Because of its importance, it's routinely one of the first things that are checked and evaluated as part of a complete blood count, or CBC. Therefore, understanding what PCV is and what it represents is the crucial first step in diagnosing and managing a wide range of blood-related conditions and ensuring your overall well-being. How do we measure PCV, or packed cell volume, in a clinical setting? It's a crucial measurement, giving us insight into the proportion of red blood cells in a patient's blood. Understanding this value is key to diagnosing conditions like anemia or dehydration. The microhematocrit method is the gold standard for determining PCV. This technique has been trusted and relied upon in laboratories for its accuracy and reliability. We begin by collecting a small blood sample, typically from a finger prick or a venous draw, depending on the patient and the clinical context. This blood is drawn into a thin capillary tube, a narrow glass tube designed to hold a precise amount of liquid. We then seal one end of the capillary tube with a special clay or sealant to prevent leakage, and then spin it in a centrifuge at a high speed. The centrifuge uses centrifugal force to separate the blood components by density. The densest component, the red blood cells, settle at the bottom of the tube, forming a distinct layer. The plasma, being the least dense, rises to the top, creating another clearly defined layer. And in between these two layers, a thin buffy coat of white blood cells and platelets forms a narrow interface. The buffy coat is quite tiny, often just a fraction of a millimeter thick, and is usually ignored for routine PCV readings, though it can be important in other analyses. After the spinning is complete, we carefully measure the total height of the blood column within the capillary tube. We then measure the height of the red cell layer, which represents the packed cell volume. PCV is calculated as the height of the red cells divided by the total height of the blood column, and then multiplied by 100 to express it as a percentage. For example, if the red cells measure 45 mm in height, and the total blood column is 100 mm, the PCV is calculated as 45 divided by 100 times 100, giving us a PCV of 45%. This entire process, from blood collection to obtaining the PCV value, typically takes just a few minutes, making it a rapid diagnostic tool. It's a quick, accurate, and minimally invasive method, providing valuable information with minimal discomfort to the patient. The clear and distinct separation of the blood layers makes reading the results straightforward and reduces the potential for errors. That's how we get a precise PCV value in the lab, a crucial piece of information for patient diagnosis and treatment. Why is PCV so important in medicine? It gives a rapid snapshot of red blood cell count and hydration status. Low PCV points to anemia, meaning not enough red blood cells or hemoglobin. High PCV can signal polycythemia or dehydration, both of which can be dangerous. PCV helps guide further testing, treatment decisions, and even urgent interventions like transfusions or fluids. It's a vital fast clue to what's happening in a patient's blood. What's a normal PCV? For adult men, it's 42–52%. For women, 37–47%. The difference is due to hormones and menstruation. Using the right reference range is crucial for accurate diagnosis. PCV changes with age. Newborns have higher values, which drop over time. Puberty brings the adult gender differences. Living at high altitudes raises PCV as the body adapts to lower oxygen. Intense exercise can cause temporary changes. These variations are normal and must be considered before diagnosing disease. Knowing what's normal prevents misdiagnosis. Always interpret PCV in context. What if PCV is abnormal? Low PCV means anemia, which can result from blood loss, decreased production, or increased destruction of red blood cells. Blood loss may be sudden or slow and hidden. Poor production can be due to nutritional deficiencies or bone marrow problems. Increased destruction happens in conditions like sickle cell anemia or autoimmune diseases. High PCV can mean dehydration or true overproduction, as in polycythemia vera. Both extremes are serious and need investigation. Persistent high PCV, especially above 60%, is a major warning sign. PCV helps pinpoint the underlying issue quickly. PCV tells us if there's a problem but not the cause. To dig deeper, we use red blood cell indices, MCV, MCH, and MCHC. These indices describe the size, color, and hemoglobin content of red blood cells. They help classify anemia types and guide diagnosis. Indices are calculated from the red cell count, hemoglobin, and PCV. Modern labs do this automatically, but understanding the numbers is essential. Knowing these details helps you interpret results and understand what's happening in the blood. Let's break down the main red blood cell indices. These are crucial values that provide detailed information about the characteristics of your red blood cells. Understanding these indices is fundamental in diagnosing various types of anemias and other blood-related conditions. MCV, or mean corpuscular volume, shows average red cell size. It's a key indicator of whether your red blood cells are of normal size, smaller than normal, microcytic, or larger than normal, macrocytic. This measurement is given in femtoliters, FL. Formula, PCV, RBC count, x10. This calculation helps determine the average volume of a single red blood cell, providing valuable insights into the cell's characteristics. Normal 8100 FL. Values within this range typically indicate that the red blood cells are of normal size, which is referred to as normocytic. Low = microcytic, high = macrocytic anemia. These conditions can point to different underlying health issues that need further investigation. MCH, or mean corpuscular hemoglobin, measures average hemoglobin per cell. Hemoglobin is the protein in red blood cells that carries oxygen. Formula, hemoglobin, RBC count, x10. This calculation provides the average weight of hemoglobin within each red blood cell. Normal 27–33 pg. This range indicates the typical amount of hemoglobin found in a red blood cell. MCHC, or mean corpuscular hemoglobin concentration, shows hemoglobin concentration in red cells. It reflects the average concentration of hemoglobin within a single red blood cell relative to its volume. Formula, hemoglobin, PCV, x100. This calculation expresses the hemoglobin concentration as a percentage of the red blood cell volume. Normal 32–36 gdl. This range indicates the typical concentration of hemoglobin within red blood cells. Low MCHC = pale cells. This condition is often referred to as hypochromia, and it can be indicative of iron deficiency or other conditions affecting hemoglobin production. The color index is older, comparing hemoglobin to red cell count relative to normal. It's a less precise measurement compared to MCV and MCHC. Normal is about 1.0, less than 1 means hypochromic anemia. This suggests that the red blood cells have a reduced amount of hemoglobin. MCV and MCHC are most useful for classifying anemia. They provide essential information about the size and hemoglobin content of red blood cells. Iron deficiency shows small pale cells. B12 deficiency shows large, fragile cells. These differences are key to identifying the root cause of the anemia. These indices, combined with PCV, give a full picture of red cell health. They help in assessing the overall condition and functionality of your red blood cells. Mastering them is key for accurate diagnosis. It allows healthcare professionals to pinpoint the specific type of anemia or blood disorder affecting a patient. Always check indices alongside PCV for a complete assessment. This ensures a thorough evaluation of red blood cell health and function. Understanding these numbers helps you spot and treat blood disorders early. Early detection and treatment can significantly improve patient outcomes. For more clear medical breakdowns, subscribe to Joen Academy. We're dedicated to providing you with easy-to-understand explanations of complex medical topics. Stay healthy, everyone, and keep learning.